Yeah, we start to let the participants in. We will give a couple of minutes to join this presentation in live. So we have several time zones. So in India, it's already afternoon. In Baltic countries, it's 10 o'clock in the morning. Я поприветствую участников, кто начал присоединяться. Этот канал будет, аудиоканал, если вы меня слышите, будет через пару минут только на английском. Для того, чтобы слушать на русском перевод, следуйте инструкции, которые вы получили в сообщении. Там несложно найти значок глобуса и переключиться на русскоязычный канал. Сегодня у нас тематика менопауза, поддержка женского здоровья, и мы ее не случайно выбрали, вы за нее проголосовали в различных чатах. Я сейчас перейду на английский. Вы сможете задавать вопросы в чате в конце нашего эфира. Через час примерно у нас будет сессия вопросов-ответов на 30 минут. Присылайте свои вопросы, желательно коротко, и если можете, сразу на английском, потому что я их буду зачитывать доктору. Если не можете, тогда буду переводить на лету. Все, тогда переходим на английский язык. So, good morning or good afternoon for India. Dr. Vikram Čauhanu, the founder and the chief doctor in Planet Ayurveda. We asked our participants to vote and to select the topic for today's seminar. So it was the collective votes from different countries, and for sure the menopause was selected as the most important topic for this moment. The format of today's presentation and our seminar is 1 hour for Dr. Vikram to present his presentation with comments, and then we have 30 minutes for questions and answers from participants. So I let now main speaker to take a word, and I will be silent. Dr. Vikram, the floor is yours.
Thank you, Alexander, for organizing this online seminar. It's a wonderful initiation to spread Ayurveda knowledge from India to around the world. This is the same mission of Planet Ayurveda. When I started Planet Ayurveda around 25 years ago, I thought that this beautiful science should be everywhere, all over the planet, and it should help everyone. So I welcome you all. I thank you all for inviting me to conduct this seminar. The view in this situation in life called menopause. In the topic you have chosen by voting, it's another excellent method to choose a topic, and I'm sure that it must be very much in demand to know about how to solve this, how to sail through this turbulent phase of life. This menopause, let us start the presentation. The menopause, as you know, the name is telling you something. Meno means monthly. In Greek language, meno means monthly, and pause means to stop. So when the monthly menstruation cycle of a woman stops, that is called menopause. It is a stop, permanent stop, when the phase of turbulence is is gone and the landing is done successfully. When the beginning of menopause in the life of a woman, beginning of menstruation, or I would say in the stage of puberty, when the menstruation begins in life, that is the phase to take off in life. And when it is menopause, it is a phase of landing. So you can relate it with the airplane. So when you are entering a puberty phase, your thoughts, your life, you feel like flying, you are full of energy, you're full of enthusiasm and lots of hope because there is hormonal surge. So some hormones, they start uh, to build up in your body during the menopause, during the puberty, during the start of your menstrual cycles, when you are about 12 or 13 or 11. So, and during the monthly cycles for about 30 to 32 years, you experience different phases of life, the childbearing age, the pregnancies, and the postnatal afterbirth phases when you have given birth to the child, the milk lactation, milk production phase, and there is lactation, feeding the kids, feeding the children, and experiencing the beauty of your motherhood. So after that, when these phases are over, and then there is a phase of stopping of menopause. The purpose of menstruation was to give birth to new life and raise new generation and keep this universal energies going, keep this next generations going for forever. So this was the purpose of menstruation, to bring new life into this world. So that's why woman is very is known as the creator. Woman is known as the creator of the world, because woman is responsible for creating new generation, next generation, and also preservation of our genome, or passing of our genome to the next generation. So it's the women, they have a very beautiful role to pass on the genome, pass on the life, and bring life into real form, into manifestation. Uh, so let's talk about what is menopause. As I told you, when the monthly cycles they stop, it is called menopause. It is a very gradual phase. It is not immediate cessation of menstruation. It is slowly, as I told you, an announcement of landing of a plane. It takes about half an hour, and similarly, in menopause can take about 5 years, 6 years. So sometimes there is, sometimes it can take 7, 8 years also. So there are so many biological and psychological changes and physiological changes happening inside the woman's body. So a lot of things the women they have experienced during their active reproductive phase of life. So now the reproduction stops during this, after this menopause. Next slide, please. So when there is a start of puberty, there is a hormone called estrogen. You can relate this estrogen to testosterone in men. Just for the common understanding, it is not testosterone. It is estrogen, but having functions to give boost, to give strength, to make physical changes in woman's body or the appearance. So when the estrogen levels they start to increase during the age of puberty, the physical changes they start to appear. The breasts they become bigger. There is growth of pubic hair, growth of underarm hair. The pelvis become bigger, So the estrogen starts to increase. The ovaries, they start to grow at around puberty, between 10 years of age to 13 years of age. And then the woman, the child which was a girl, and now she starts to become a woman. And slowly, by the age of 14, 15, the girls, they start to become women, and they have attained full reproductive age by the age of 18. And then slowly, when the age goes higher and higher, and the estrogen levels, they start to decrease. Estrogen is responsible for the strength of the muscles, strength of the bones, and strength in the mood, also excitement, happiness, and also physical strength of the woman. And by the passage of half of the age, when the woman is around 50, the estrogen levels, they start to decline. So then it is called the age of menopause. Next slide. So we can say early menopause, perimenopause. There are certain stages when there is the menopause is because before the 45 years of age, we can say it is early menopause. When it is around, when you experience certain symptoms like hot flushes, palpitations, irritability, and fluctuation of mood, such changes, when you feel, this is called perimenopause phase, or when you feel that there is something happening to me, then it is around the menopause time, that is called perimenopause. Next slide, please. Next slide, please. Next slide. I think, okay. So then there was pre-menopause, then there is menopause, then there is post-menopause, after menopause. After the woman is not menstruating at all, menstruation stops completely, and the ovaries, they start to stop, they stop functioning, they stop releasing the eggs. That is called postmenopausal phase. Basically, the estrogen is formed in the ovaries, and the ovaries, they are responsible for release of estrogen, and then the ovaries, they start to shrink during the menopause, and after menopause, the ovaries, they shrink completely, and they stop releasing the eggs, and the estrogen levels, they go down. Next, please. Next slide, please. So these are the, so before understanding menopause, I want to explain you how these hormones, they work, so that you know, because the doctor, they keep prescribing you hormones, and you don't understand why the hormones are given. So just understand that there are two hormones. Estrogen hormones is boosting hormone, and progesterone hormone is calming hormone. So whenever you are full of excitement, energy, and enthusiasm, and like excitement, that is estrogen. And progesterone is when you have in a phase of uh, calmness, peace, happiness, love, that is progesterone. So this is a balance of woman's life, is a balance of estrogen and progesterone. Similarly, these estrogen and progesterone, they are responsible for the menstruation. So during the menstrual cycle, in the beginning of the menstrual cycle, the brain is pushing the the pituitary gland is pushing the ovaries to release estrogen. Estrogen is also responsible to for the ovaries to make the eggs, to make the follicles. It is called, the egg is called follicle in medical language. So the brain or the pituitary gland is releasing the follicle stimulating hormone, or FSH. So pituitary gland is releasing FSH, and also asking the ovaries to make estrogen. The estrogen from the ovaries will increase when there is just after the in the first 14 days of menstruation. So the estrogen is increasing, the body is preparing the follicles, the ovaries are preparing the eggs. And after about 13, 14 days or 12 days, the eggs are mature and the the egg rupture and the follicle ruptures and the egg is outside of the ovaries and it travels into the fallopian tubes and it goes into the uterus. So that uh, the union with the sperm can take place in the uterus. So that is the process of generation of next generation or the reproduction. So if there is presence of sperm, if the sperm comes, then the egg is fertilized in the uterus, and then there is formation of embryo or baby, and it is implanted in the uterus. If the sperm is not there, or if the sperm is not able to penetrate the egg, then there is no fertilization, then the egg is wasted, and then the it is destroyed, and then after about 10 12 days there is menstruation flow, and the endometrium of the uterus which was thickened to accept the egg, to accept the embryo, to accept the baby. The bed was ready in the uterine lining was ready, and the uterus was bulky and big. So, but because it is not fertilized now, so it sheds the egg, and everything goes out in the form of menstruation. So this is a normal process. First, there is for FSH, then follicles formation in the ovary. Ovary is there. Is trying to make an embryo with the egg, fertilized egg, and there is progesterone. Progesterone just after the ovulation, when the follicle ruptures in the ovary and the egg is released from that follicle, there is a formation of release of progesterone hormone to thicken to prepare the bed for the baby, for the baby. The internal lining of uterus starts to thicken up. If there is fertilization, then the progesterone levels they are increased during the pregnancy. But if there is no fertilization, then they go down. So these estrogen and progesterone, these are two important hormones in females' menstrual cycle, and they are maintained by the FSH and luteinizing hormone. Luteinizing hormone is also coming from the brain, from the hypophysis or the pituitary gland. So I'm saying brain because they are located in the brain, in the middle of the brain. So LH and FSH, they are released to control the secretion of estrogen and progesterone from the ovaries. So ovaries are the important organs in female body, which are responsible for for giving birth to the eggs. So there is one egg released every month. So you can imagine how this universe is creating such a balance or such a beautiful way of creating this uh, universe or the next generation or giving birth to new life. Next slide, please. Next, next slide, please.
We have
Maybe I can try.
a little interruption time to time in sound, but I hope it will normalize now.
Okay. So what is the role of estrogen? So as I told you, uh, I am trying to teach you very basic things. I don't know whether you are aware of these things or not, but just imagine there is an organ called ovary in a female's body. There are two ovaries beside the uterus. Uterus is also called the womb, of the woman where the baby grows. So around the womb, there are two ovaries, and those ovaries, they are producing the eggs every month. One egg is produced in right ovary, and next month another egg is produced in the left ovary, and then similarly they turn by turn they release one egg every month. So if the egg is fertilized, then the fertilized by the sperm, then the baby is born or baby starts to grow. Otherwise, if the egg is not fertilized, then the egg is wasted in the form of menstruation. Then the menstruation flow will release the thickened endometrial lining of the uterus. The uterus lining is thickened every month, and once the egg is not fertilized, then with the flow of menstruation, the lining disappears. So this is a normal physiology of how the woman body is working. So what is estrogen doing in females? It is helping the ovaries. It is stimulating the ovaries to generate the follicles. Follicles are containing the eggs. So once the follicles are formed, then the egg is follicles they rupture and the egg is released. And it also maintains, estrogen is maintaining the thickness of the vaginal wall and also promotes the lubrication. So if there is no estrogen, there is no lubrication, and there is dryness of the vagina. Inside the vagina, there is dryness, and that leads to painful sexual intercourse also if there is less estrogen in females. So estrogen is very important for lubrication. It is basically promoting the fertilization process, and it also enhances and maintains the mucous membrane that lines the uterus. Uterus, as I told you, it is called womb, and womb internal lining of the uterus, it is it slowly it is thickened, and then it is shed whenever the estrogen levels they decrease. So if there is no fertilization, if there is fertilization, then in the thick mucous membrane or the endometrium, internal lining of the uterus is called endometrium. So in endometrium, the baby is implanted or the embryo is implanted, and it grows in the endometrium, and then it gets blood supply from the mother, and the baby is growing inside the womb. So estrogen levels, the function of estrogen is only to produce the eggs and help to generate the eggs in the body. And then if it is fertilized, then the next hormone, next slide please, the progesterone takes over, and the other hormone is called progesterone. So progesterone is responsible, as I told you, it is love, it is calm. So it is calmly and lovingly implanting the baby or the embryo or the fertilized egg, or to make a fetus, to make a baby into the inner lining of the uterus of the womb, and that is called fetus. And it helps to calm you down, it helps to improve your mood, it helps to make you happy, and maintains the calms down the stress levels, and it also regulates the menstrual bleeding. It is mainly progesterone means from P, progesterone means peace. So peaceful hormone. Next, please. Next slide, please. So what is testosterone doing in the females? There is mild level of testosterone also in the females. It regulates sexual desires and also uh, enhances libido and improves mood and energy levels. So it is not that testosterone is not there in females, but too much of testosterone can lead to different personality types, or too little of testosterone can also lead to different in personality types. So little bit testosterone is also there in the females. Next, please. Next slide. Okay, so what are the causes of uh, menopause? When the ovaries they start to shrink, when the reproductive phase of woman life is over, when the woman is not going to give of birth to a child, then the menopause sets up. This is a nature system. So the stopping of formation of eggs in the ovaries, so that is called menopause. It is a natural phenomena. It is physiological. It is natural. When the estrogen and progesterone levels they start to decrease, and then there is setup of menopause, usually at the age of 45 to 55. Next, please. These as the estrogens and progesterone levels they are decreasing, the ovaries they are not producing estrogen, they are not producing progesterone, so the ovaries they start to shrink. So they are not functioning because the reproductive age is going and the lady is getting older. So the ovaries they start to shrink. But the FSH levels and LH levels, this for sometimes from the pituitary glands, they are trying to push the ovaries to release the estrogen and progesterone to make the eggs. But still, after menopause, the levels they go down. Next, please. Sometimes menopause is induced by medical procedures by removing the ovaries because sometimes there can be problem in the ovaries, problem in the reproductive organs, some ovarian cancers. So menopause has to be medically induced. So there are so many reasons to cut down the ovaries. That is called bilateral oophorectomy. This surgery, name of the surgery is called oophorectomy. Bilateral means both the ovaries they are removed. So surgical removal of ovaries is called bilateral oophorectomy in case of ovarian cancer in a young woman when both the ovaries are removed. Ovarian ablation is also when we burn the ovaries, ablate the ovaries, or we just inside the body we destroy the ovaries to stop there. Menopause reduction, temporary or artificially induced. Next. So there are so many other causes of menopause. If there is some radiation, too much pelvic radiation that can destroy the ovaries, that can also lead to menopause, and the injuries which are occurring in the pelvis, which can damage the ovaries, that can also lead to menopause. Next slide. So symptoms of menopause. Yes. So menopause, as I told you, it is a turbulent phase. It is a landing phase. You can correlate it with the landing of an airplane. Vasomotor means, in medical terms, there is a change in the blood pressure. The hot flushes are there. The women, they are finding difficulty in sleeping. The sleep is disturbed. The urinary tract infections are more common. Osteoporosis is there, weakness of the bones because estrogen is falling, and estrogen is responsible for giving the strength to the bones. And the energy is getting down. There are psychological symptoms also, irritability, anger, lack of sleep. Such symptoms are there. The skin and hair they become dry. The sexual dysfunction is also there. The vagina also becomes dry and can also cause loss of libido, and due to loss of lubrication there is painful sexual experiences. So low libido also there. These are the symptoms there is weight gain also because of retention of water. The metabolism goes slow, and there is because the metabolism is slow, and there is weight gain after the menopause. Next. Hot flushes, palpitations, fatigue, tiredness, weakness, sweating, and skin vasodilation, dilation of the blood vessels in the skin. Such symptoms are there. Next. And in the urogenital symptoms, there is the urine. Urine is not the woman is not able to control the urine. The urine is passing on its own. Sometimes there is droplets. When somebody is coughing, there is loss of urine drops, and also the recurrent urinary tract infections, painful urination is there. To go to pee on and on is also common. There is itching in the vaginal. There is dryness in the vaginal area. There is leukorrhea. There is white discharge from the vagina. That is also common menopausal phase. Okay, next. All right. Okay. So the sexual dysfunction, as I told you, low libido, there is no desire for sex, less desire for sex. Atrophic changes. Atrophy means the ovaries, they shrink. Not only the ovaries, they start to shrink, but also loss of skin tone also there. The skin also start to lose the shine and the brightness, and also the collagen also starts to decrease. There are psychological changes also in the woman's mood also fluctuates. Next, please. Next. There is stress, anxiety, phobia, lack of sleep, insomnia, irritability, anger, depression, mood swings, and low memory, not able to concentrate. Such psychological symptoms are there in menopause. Next. And of course, skin thinning is there. Because of women, they love to look younger. Women want to see the woman, they want to look young, and they are very much worried about if there is appearance of wrinkles or some loss of shine or loss of elasticity on the skin. So they also get very much worried to see the loss of elasticity of the skin and wrinkling of the skin. So they start going to the detox or botox clinics, or some artificial cosmetic clinics. So according to Ayurveda, or according to me, so there are so many ways we can prevent this. I will tell you what to do in the coming slides. And crow feet, such crow type feet around your eyes, they start to form. And purse string wrinkling around the excuse me, yes. And there is a loss of the hair, they also start to thin, and there is loss of hair. So such changes skin and hair. That is why so many products, multivitamins, people, they start to consume, the women start to consume multivitamins, collagen, they start to consume skin and hair capsules. So they get worried a lot about their looks. Next, decline in collagenous bone mass. It is not only the menopause is not only affecting the outer looks, it is also affecting the inner strength, the bone matrix, the pain starts to appear in the back, loss of height is there. Later stages, there is kyphosis or the bending. Old woman, you start feeling like old. It is not with every woman, it is some severe cases with some women who are uh, having severe symptoms of menopause. But still, slowly, they at the age of 60 or 70 or 80, you can feel these symptoms are there. Next, next slide. Okay. So how the doctors they can diagnose this menopause? Sometimes the woman is not menstruating at the age of 45 or 47. So she comes to us and we ask the first question, for how long you are missing the menstruation? If it is for continuously 1 year, then we can think about menopause. If it is continuously for 3, 4 months, then we don't think of menopause. So complete absence of menstruation for continuous 12 months, we can diagnose it as menopause. And other symptoms like hot flushes, irritability, weakness, and we can also check the estrogen levels. Estrogen is also called estradiol in some countries like England, Britain. So estradiol is down less than 20 picograms. Usually it is more than 50 to 300. So if it is going down to less than 20, and we can also check FSH, follicle stimulating hormones and luteinizing hormones. If they are also less, then we can diagnose it as menopause. Next. So these are the numbers. So in the you can see in the post-menopause woman, the numbers they come down drastically. In the adulthood, during the different phases of menstrual cycle, the estrogen levels they can go up to 50 or 200 or 300 also. But here we have shown 30 to 40, and then if it is less than 30, then it can be diagnosed as menopause. So similarly, other hormones they also go down. Next. So there are other tests which we should do to take care of the woman who is already in the menopause. Uh, we must check the serum calcium levels because the calcium levels they start to drop in menopause. The bone density must be measured because bone they also start to lose their density. Mammography to see any changes in the breast and monitoring of all other vital organs and vital functions of their organs, and blood tests to check blood sugar levels because the blood sugar levels they can also get increased. So these tests we can perform to diagnose. Next, please. So now coming to Ayurvedic view, as I told you that it is a reproductive cessation when the woman is losing its capacity to give birth to the new generation, then it is going in the phase of menopause. So Jara Pakva Avastha is or Rajo Nivritti, it is called menopause in Ayurveda, and it is linked with Vata stage of life. So when in the beginning of life there is Kapha, in the middle of life there is Pitta, in the end of life is Vata. So don't think that at the age of 50 it is end of life, but it is the beginning of the end, you can say. So the end is 100 years, but it is declining at the age of 50, 55. Next, please. Next slide. So there are different uh, types of menopause according to Ayurveda. When the Vata is dominating, Pitta is dominating, and Kapha is dominating, we have to analyze if there is Vata dominance. These are the Ayurvedic principles. I don't know if the listeners or the participants they know Ayurveda or they don't know Ayurveda. So I have to tell you something about Ayurveda also. Ayurveda is traditional Indian medical system or a very ancient medical system made up of two words, Ayur and Veda. Ayur means life and Veda means knowledge. So it is telling us about, it is giving us the knowledge of life. So the Ayurvedic philosophy says that the whole world or the whole universe is made up of five elements: earth, water, fire, air, and space. So these five elements in the universe, when they join with the soul, that becomes life. So we have to take care of this life, and those five elements, they are represented by these three energies called doshas: vata, pitta, and kapha. So vata is air and space, pitta is fire, and kapha is earth and water. So earth and water is kapha, pitta is fire, vata is air and space. So these vata, pitta, and kapha, these are the three energies which are representing these five elements: earth, water, fire, air, and space. And they are run by this soul. So pitta, as I told you, is representing the fire. And if the fire is imbalanced, then there are symptoms like hot flushes, irritability, anger, or fire symptoms. If there is vata, vata is air, and if there is vata dominance in the symptoms of menopause, there will be movement difficulties, like there will be too much movement in the mind, in the thoughts, anxiety, phobias, fears, insomnia, and osteoporosis or dryness because of the vata. So such symptoms we can analyze whether it is vata imbalance or pitta imbalance. Next, please. And then there can be kapha imbalance also. Kapha is earth and water. In earth and water means too much of weight, too much of licoria or the white fluid from the vagina. That is because of the kapha dosha during menopause. Next. So in vata predominance menopause, we give warm food, warm drinks, because vata is cooling, vata is cold. So it increases the coldness in the body. So we give warm and uh, warm food and drinks. We use spices, we use fennel and cumin tea, and we decrease heating things like caffeine and other stimulants, or drying things, or refined sugar and cold drinks, and also salads, because salads, they are very light. So light causes gas formation in the gut and leads to imbalance of the vata. So that's why salads are also not recommended in the vata menopause. So we have divided menopause into vata, pitta, and kapha. So vata menopause, pitta menopause, kapha menopause. Vata menopause is we have to stop cooling and drying things, and in pitta, eating things, in kapha, too much heavy things. Next, please. So in vata, we need to relax, we need oil massage, we need to calm down, drink some oil and ghee, regular exercise, and calming meditation and yoga. Next, next. So in pitta, pitta, as I told you, is fire. So we need to give cooling foods. Water is the best for pitta. Juicy fruits, grapes, pears, mangoes, melons, apples. All these fruits and vegetables which are rich in water should be given in pitta dominating menopause. Next. Avoid spices, too much heating food, hot drinks, alcohol in pitta dominating menopause. Next. And oil massage using coconut and sesame oil is very good for pitta. Meditation is very important to reduce anger and hatred and resentment, jealousy, and such uh, pitta dominating feelings. They should also be reduced. And in kapha, just prefer light food. The salads can be given in kapha dominating menopause. Fruits, grains, legumes all should be consumed. Peppers and turmeric, ginger, they all can be. Heavy and cheesy, greasy diet should be avoided in kapha menopause. Next. Next, please. Yes, heavy food like meat is not recommended. Fasting is good because it causes lightness, and avoid having food after 6 p.m. Okay, next. Get up early, exercise, massage with the mustard oil and linseed oil. That is very important because they are heating to the body and they can melt the kapha quickly and also help to reduce the weight of the body. To get rid of the excessive weight, you must get up early and massage with linseed or mustard oil. Next. So there are certain supplements which I have made. I have tried to made so many supplements and helped so many people suffering from different ailments. And what we should do in menopause, we should try to give support to the hormones which are going down quickly, uh, which it we have the smooth landing of the plane. So we support the ovaries. Shatavari is asparagus racemosus, is a plant. It's the roots of that plant. The products which we have made, they are 100% natural, free from any chemicals or fillers or any colors or flavors or anything artificial. It's 100% natural. So I I'm making them for my patients, which I love them very much. So Shatavari capsules. Shata means 100. Vari means mm, you can say husbands. So it gives the strength to the uterus, Shatavari. And female health sport also contains Shatavari and Ashoka and Lodra. Such certain herbs are there which are having natural hormones, natural estrogen like natural ingredients, plants. For example, Ashoka is having natural phytoestrogens. Shatavari is also having natural proteins and certain estrogen uh, type of uh, type of hormones. Brahmi is very good for the brain, for the memory, for the calming down the stress, anxiety, insomnia. So mental symptoms, Brahmi is wonderful. Next, please. Next slide. Brahmi is something which is 100% working in all the women. So this main ingredients in this shatavari is asparagus. In female health sport is shatavari and ashoka. They have anti-inflammatory and contain estrogenic compounds. Next, please. So next, please. Yes, Brahmi is Bacopa monnieri. It is helping to calm down the nervous system for overall well-being, for insomnia, for restlessness, for anxiety, fear, and phobias, and also for anger. So anybody angry, just consume Brahmi, you will be calm, and it is 100% sure. Next, yes, next, please. Brahmi, Shtavari, and female health sport. Next, please. Next slide, please. So, thank you very much. I hope this was useful and it will help in combating your symptoms and help you blending smoothly in and open a new chapter in your life.
Yes, thank you, Dr. Vikram.
Yes.
It was great presentation, and as usual, we accepting the questions from our participants in the chat of the
Yes.
Zoom. So I already have several questions, and one of them is it possible to slow down skin aging and joint diseases with the help of Ayurveda?
Yes, of course, it is possible to stop joint pains and prevent aging Uh, Vitamin C is very important for to prevent aging. And the best source of natural vitamin C, I'm not advocating chemical pills based vitamin C. I'm advocating natural flowers, trees, plants, fruits, which are full of vitamin C. So you must know what are the those things which are having natural vitamin C. This vitamin C, this amalaki is Indian gooseberry. So Indian gooseberry is world's richest source of vitamin C. One small berry is having 30 oranges equivalent of vitamin C. So one small berry is having so much vitamin C in it. So vitamin C stops collagen decline. So it can bind to the collagen. It can stop the collagen depletion. So it can prevent the wrinkles. It can prevent aging in any form. It can prevent the aging of the arteries, aging of the eyes, aging of the skin. So a formation of any cellulite in the body. So everybody must consume vitamin C for their eyes, for their hair, for their nails, for their skin as anti-aging. So what are the sources of vitamin C? As I told you, Amlaki Rasayan, we have capsules also made from that gooseberry. But if you don't get capsules, you can consume fresh pomegranate every day. Pomegranate, I think you don't get in those colder climates. So pomegranate, you can try to find out. And I think sea buckthorn is there, which is growing there in your area. So sea buckthorn is also one of the good sources of vitamin C. So many fruits and oranges, lemons, all such things are rich in vitamin C. But according to Ayurveda, we don't recommend too much of lemons because they and or sour things. So in Ayurveda, we don't recommend sour things because they can deplete so many other things. So in order to prevent aging, vitamin C is must. Other things are oils, which are very important to prevent aging. Uh, this, as I told you, mustard oil and olive oil, massage with them. So massage your skin, your body with the oils because it is vata time and you are losing your skin texture. So almond oil is also very important. So every day you consume one spoonful of almond oil just as it is. Just buy almond oil from the market. Just start consuming one tablespoonful every night. You will see you will get younger and younger every day. And for joint pains, you need to take some anti-inflammatory, natural anti-inflammatory, not artificial pills, no painkillers. So for joint pains, turmeric is the best to stop the pains. So it all these herbs which I'm telling you, they are not going to give results in one day. It will take some time. So turmeric takes 1 week, 10 days. So always take turmeric, one spoonful, teaspoonful of turmeric with water every day. So it will stop the pains. We have curcumin. The turmeric has curcumin as a chemical or active alkaloid in it. So you can buy curcumin capsules. We have standardized it to 95% high content of curcumin. So very strong for joint pains, inflammatory conditions, uh, osteoarthritis, and a herb for to prevent this osteoporosis for calcium. Nuts, nuts you must soak nuts, must consume nuts. So simple things, nuts, berries, all these nuts, sea buckthorn, amlaki, uh, seeds, all the seeds, they are rich in omega 3s. They also prevent these aging. So nut, all the natural things you must focus on. Nuts, seeds, fruits, cherries, berries, all these things, they are good for your aging process. And for pain, turmeric is best. This curcumin capsules you can take. And we also have joint aid plus. We also have these osteoplan or cissus. There is another herb called cissus. Scissors is, if you look at the shape of the scissors, it looks like a bone. So to prevent osteoporosis, to give strength to the bones, this scissors quadrangularis, or I can type it for you. This scissors power. Just a second.
We have this product in our inventory, so we can provide as well. Some links will be published in the chat after this event.
So I wrote the name of the herb also so that they can read about the herb. It is called Cissus quadrangularis. So we have the Cissus power capsules. We have this curcumin 95% capsules for pain and inflammation. And so all these things you can use. So any other question?
Yes, for sure. We have a lot of questions. This pretty common question, what I also facing during my practice. How does the effectiveness of Ayurvedic remedies compare to hormone replacement therapy or synthetic hormones?
Because people, they don't know Ayurveda. So they have doubts whether it will work or don't, or won't work. It is working from thousands of years. Thousands of years. So it is very effective. It doesn't need, it has already passed the test of time. So many years in India, Ayurveda is flourishing. People of India, they are using these traditional remedies for thousands of years. Just put some ginger in your mouth and chew it. Will you feel the heat? Yes. If you chew some black pepper in your mouth, if you chew, you will feel it is working. Similarly, these herbs, the ginger and the black pepper is heating. They work quickly and you can feel the effect. They are working. Similarly, the cooling herbs like shatavari and the female health sport, they really, really work very quickly with, and also Brahmi. Within 1 month, you will see the results. There is no need of any hormone replacement therapy, no need of estrogen, no need of any progesterone, nothing. So those hormones, they are given in too high dosage. And once they are in your body, the body is up and down. The body is confused. The body is landing slowly, but you put some turbo fuel, and it is the plane is again turbulence mode. So we need to give easy landing to the plane. We need to give the nutrition or the calming effect to the body. So this shatavari, this female health sport, these natural herbs, they work really, really well in such cases.
Can we also address here the question, another question, what do you think about the progesterone in the form of gel obtained from the wild yam?
Yes,
What is your...
very good. Very good. I like natural herbs, plants, trees, fruits. Wild yam is excellent. I like it. So this wild yam uh, is also one of the ingredient I use in wild yam. I am using somewhere Fureria tuberosa, Vidarikand. I am using the powder of that wild yam in my patients here in India. But I think we don't have wild yam there. But I am using shatavari. Shatavari is also having this similar properties like wild yam. So shatavari is equally good as wild yam, or I would say a little bit more because it has more mimicking estrogen mimicking compounds, saponins. Wild yam also has saponins, but so in replacement of wild yam, you can use this shatavari. Wild yam is Pureria tuberosa. This is the Latin name of. I can write it down here. Shatavari is equivalent. Okay. Next question, please.
Well, pretty deep chemical internal chemistry question. What is your point of this? Is it possible to replace the work of the ovaries by stimulating the adrenal gland?
Stimulating adrenal glands? No, because adrenal glands, they are secreting different hormones. They are secreting corticosteroids, cortisol, and adrenaline. So adrenaline has different functions. Adrenaline is altogether different than estrogen, and this cortisol is altogether different than progesterone. So I don't think it is a good idea to stimulate these adrenal glands to take the action of to do the action of estrogen or progesterone from these. Although they are also stimulating, this adrenaline is stimulating, estrogen is stimulating, cortisol is also, it has entirely different functions. So it is not practically advisable.
Okay, and we're also facing a lot of myths which are available on the internet. And sometimes it's myth, sometimes it's doubts, or people just afraid to use the Ayurvedic medicine. One of those is, what is your position on the Shatavari and the Kistas? Because sometimes people think that it stimulates of growth of the Kistas. Is it so or not?
Growth of the what? Kistas?
Yeah,
What is that?
Kyst, the new
Cyst.
growth or cyst. Yeah.
I don't agree with that. Shatavari is not increasing the growth of the cyst. It is, you see, there is a negative feedback mechanism in our body. What is that negative feedback mechanism? If we put estrogen in the chemical form in our body, the brain will release hormones to neutralize it. So that it is not too much. So when we give the pills, so the body is trying to calm and reduce the level of the hormone which we give through the pills. So the body is confused, and that leads to cysts, that leads to growth, that leads to problems. Shatavari is a very small quantity, minimum quantity. It is not bombarding the body with a lot of estrogen. It is phytoestrogen. It is absorbed slowly and slowly working and slowly getting getting out of the body. So it is not causing any cyst formation or anything. In fact, cysts, they are formed because if we are consuming too much cheese, too much of dairy products, which are full of hormones from too much quantity of hormones. So that's how the cysts in the body, they are formed.
We can promote the physical activity also to reduce the cyst formation. At least it's the experience of our colleagues.
Yes, of course. Cysts, they are formed because when you are not moving in the day, so exercise is must. Exercise is, those who don't exercise, they have to find time for certain diseases. If you are exercising, then the diseases, they don't come because you are burning the toxins in the body. So it is exercise, water, sleep, stress-free life, nutrition, all these things. This is what Ayurveda says. Ayurveda is not telling you about supplements, use of supplements. Ayurveda is telling you about how to live healthy, how to gain the knowledge of life, so how you can maintain the balance of life. So there are so many things like good sleep, happy living, happy emotions, meditation, yoga, exercise, disciplined life. All these things are taught in Ayurveda. So it is really, really a preventive medicine as well as therapeutic, as well as treatment part. But mainly when we are focused on preventing something, then the diseases they don't appear. We change the diet, we change the lifestyle, we change the thought process. So we change the behavior with the society, with yourself. So this is how it works, and it can prevent all the diseases. That is Ayurveda.
Okay, thank you for this input. Yes, another pretty common question about the ashwagandha, especially in the case of high vata dosha. What is your view?
Yes. Ashwagandha is excellent for vata. It is meant for vata. Ashwagandha is heavy, guru. So vata is light. So the principle of treatment in Ayurveda is use opposites. So if the vata is high, then use something which can reduce the vata, because vata is light in nature. So when there is too much of vata, too much of lightness, too much of mobility, or too much of coolness, vata is mobile, vata is cool, vata is light, vata is dry. So we need to eat something or give something which is opposite to this lightness, coolness, dryness. So ashwagandha is opposite to all these properties. So properties of ashwagandha is heaviness and smoothness and warmth. So and not so dry. So unctuous. So these are the properties of ashwagandha. So it's excellent. And also the prabhava or the physiological effect of ashwagandha. There are so many effects of ashwagandha: calming down the vata, calming down the nerves, toning down the muscles, calming, relaxing the muscles, building the muscles, building the strength. So I have done my thesis on ashwagandha during my MD. So especially on the muscle loss in diabetic patients. So for bodybuilding also it is very good. Exercise, take ashwagandha, and you will have a lot of strength.
Thank you. And a question from our colleague from Latvia, from Romuald's. He's asking, what is your suggestion for our product of Eve Plus, what produced by Planet Ayurveda during the menopause? Do you suggest it?
Yes, it contains certain herbs which are uh, similar like shatavari and do you have female health support there?
We have available in the stock, especially for Estonia, Lithuania. Yes.
I have, it is similar product to Eve Plus. So Eve Plus is not much different than female health support. So all the functions of E Plus are similar to female health support. Sometimes I need to give higher dosage of different products. So that's why different names. E Plus is having similar function like female health support.
Okay, thank you. And again, regarding the physical activities, the question from Yelena, is it yoga exercises stimulates the hypophysis? Is it also some kind of hormonal substitutional therapy?
Yes, very much right. And that's what we should do. Because yoga is union. Union means union of soul with God. That is the purpose of yoga. That is why yoga is done, why it should be done, to join our soul with God, Supreme Soul. So that's how yoga was invented in India thousands of years ago. But now only one part is practiced, that is asana, or the physical form or physical exercises. Yoga is not only one part, it's 8 part or Ashtanga Yoga. Yama, Nema, Asana, Pranayam, Pratyahar, Dharana, Dhyan. samadhi. So these 8 limbs of yoga, one limb is asana. Asana is these postures, physical postures or physical exercises. So yes, of course, you can do physical exercises, all these asanas, yoga postures, you can do them. But other things you must also do. For example, these pranayama or the breathing exercises or yama or nema. Yama, nema are the first steps. Discipline towards your society, your behavior towards your society towards your friends and relatives. That is also part of yoga. The first step of yoga is how you behave. And second is how you behave with yourself, discipline for yourself. Get up early in the morning, go to washroom, clean yourself, and live a disciplined life. That is, pray to God, all these basic things. That is yama and nema. And then there is asana, is these postures, physical postures. Then there is pranayama. Then there is pratyahara. Fifth step is pratyahara, when you give up your attachments to this worldly world. That is pratyahara. Then there is when you give up your desire to accumulate things. That is pratyahara. Then there is dharana, dhyan, and samadhi. 5, 6, and 6, 7, and 8 steps. So dharana means you make up your mind to focus on something. Dhyan is you focus on something and then you meditate. So all these things, these steps you take to meditate and think about the purpose of our life and how and why we are in this world and who is running this world, and stay connected with the universal energies or the supreme energy, that is God. So you can do yoga to keep yourself calm.
Thank you for detailed answer. And you mentioned during the presentation several times about the meditation and its benefits for stage of menopause. And another question, actually, it's very timely. I'm glad that Svetlana sent it to our chat. I'm encourage our participants also to send more questions. But it's regarding the books. Please advise, maybe there are books that describes the properties of medicinal plants in India in comparison with the medicinal properties of plants in Europe and Russia. So here I need to mention, of course, our book translation to Russian language done last year, couple of years before that in Latvian and several other languages. Maybe you can give some review on your book, encourage to read it, and then regarding this question of the comparison of the activities.
Well, there are so many books, many doctors or many Vedyas or Ayurvedic practitioners, they have written on various herbs. I have also written I have also written a book, Ayurveda, God's Manual for Healing. It's about how we can heal ourselves and how God gave us this beautiful science of Ayurveda to heal ourselves. So this book has been translated in so many languages, in European languages, and also in Indian languages in India. There are some books I'm writing on other topics also. I wrote a book on medicinal plants also, and I am going to include some European herbs in that book. We have an academy also, Peace Academy in Slovakia. So we are teaching Ayurveda in that country, and I have done some research on about 20. I have included 20 European herbs in that book. So that book will be out soon with those herbs. There are many other doctors or the practitioners or Ayurveda lovers. Dr. Vasant Lad is there. I can write down the name of the doctors. You can check. Dr. Vasant Lad is there. He's famous for books. Many books he wrote.
I believe Dr. Robert Svoboda should be there.
Dr. Robert Svoboda, I wrote already, is there. Dr. David David probably is there.
And the book in Russian is available on the websites both for the Baltics and Russia and the CIS region. And we send it over to Europe, so you can obtain it through the website. So we have another question if you're ready to continue. And it's completely in regard of this lecture today. If a person has the symptoms of both Vata and Pitta menopause, what you can recommend in that case?
If you ask me, the supplement Shatavari is good because Shatavari is calming Vata and Pitta. Female health spot also good. Brahmi is good. So these three supplements which I have recommended, they are good for Vata and Pitta. Usually Vata Pitta symptoms are predominant in women, and mostly women, they are too much Vata and Pitta, Prakriti. Because of Vata and Pitta, there is movement in the world. The whole world is moving because of the woman, as you can see. So the predominant energy in the woman is Vata and Pitta, mainly Vata. So Vata is responsible for all the shopping malls in the world, all the movies, all the luxuries, all the perfumes, all the brands. So women use. If there are no women, there nobody will be going to the shopping malls. So Vata is predominant symptom of the woman. So calming food is important. Soups are very important. The warm, because Vata is cool and Vata is drying and Vata is flying and mobile. Vata is transparent. Women are also transparent from the heart. Women are clear-hearted. They are not. Kapha is earth and water, so they are not so clear-hearted. The Kapha people. So women are usually Vata and Pitta, so they are clear-hearted. They speak clearly, and their communication skills are better than men. So this is about women. So about the food in this: calming, warm, hot, and oily, because Vata is drying. So you need to put some ghee in the soups. So whatever soups, vegetarian soups or non-vegetarian soups you are preparing, you must put some ghee in that. So ghee is very good. Oils are very good for the Vata Pitta menopausal symptoms. Almond oil is okay, very good. Massage with different oils is good. Internal consumption of ghee is must, because ghee is the best for pitta. Ghee is best for vata. So different type of ghees, trifla ghee or ghee made from many herbal ghee are available in the market. So ghee can also be made at home. So you can learn how to make ghee over YouTube, and then you can make your own ghee. And you can also cook khichdi. Khichdi is an Ayurvedic recipe from rice and moong dal. It is also calming and light, easy to digest. But you must put some ghee in that khichdi also. So other herbs like spices are okay, but not too much. Don't make it too much spicy because it can aggravate pitta. But spices are heating and they are good for vata because vata is cooling. So the principle of Ayurveda is using the opposites. So you can use uh, something little bit heavier like oils and ghee, and calming like shatavari, brahmi, ashwagandha, amlaki also very good for pitta, also good for vata. So certain herbs and herbal teas, all kind of herbal teas, cumin, fennel, thyme. Instead of thyme, because it is heating, if there is too much pitta, you can put in some coriander. Coriander juice can be given for pitta, and cumin and fennel tea can be used for vata. So keeping these basic things in your mind, you can use these herbs in the remedies.
Okay, thank you. We have 10 minutes left. And the following question is from Natalia, and it's again about the topic of today. What you can suggest of for the early menopause stages?
Yes, early menopause usually happens because of too much stress and lack of nutrition. So when the woman is in stress and the nutrition is not so good and the sleep is not so good, then the woman is the body is undergoing tremendous stress, physical stress. The cells, they are dying. So to prevent the death of the cells, you must sleep. So the sleep must be good. So we must use ashwagandha in that case to improve the sleep quality, to improve the muscle strength, to improve the nutrition part. Amalaki is very rich in natural calcium, so full of calcium. You must consume some nutritive foods, nuts. You must consume nuts and also some green juices. Green juice made from all the greens every day, full of nitric oxide, full of life. So these natural greens, soups. Basically, you need to give nutrition in premenopausal. Nutrition, live a stressful free life, meditation, calming down, sleep, for depression, anxiety, sadness. This Brahmi is excellent. All the women, they tell me that I am better after taking Brahmi. All the women who are sad, who are having fluctuation in the mood swings, and stress, anxiety, palpitation, anger issues. Yeah, all the women, whenever I give Brahmi to them, 2 capsules morning, 2 evening, they so after 1 month. Even their husbands, they say, "What you have given?" She is happy all the time. So the husbands, they see the results. So whenever they don't consume Brahmi, the husbands, they they know that she has not taken Brahmi from last 1 week. So this Brahmi, they should consume. It is calming to the mind. And nutrition, Shatavari is good for the nutrition of the ovaries because you are losing estrogen. You are there is the imbalance of the hormones. Whenever we are thinking too much, whenever we are in stress, that leads to imbalance of the hormones. It is very important to return to these basic things. What is the basic thing? Sleep, food, stress-free life, water. These are basic. And your behavior with yourself. So start loving yourself. That is the bottom line. If you are not, and exercise. These 4 5 things: exercise, sleep, nutrition, and stress-free life, water intake. These are the basic things. So start loving yourself. Work on your thoughts. Write down everything, whatever you are doing every day. So slowly, you will change your habits. Once your habits are changed, you will change your subconscious. And once you change your subconscious, you will change the pattern of your thoughts. And once your thoughts are changed, then the hormones will change. So all the hormones, they are changed because of the thoughts. So you have to change your thoughts. So that is how we can control these ups and downs of hormones. Meditation. Yes, next.
So it was the great note to finish this event, but still we have some important questions, like from Tatiana. What is the natural sources of estrogen?
Yes, there are so many. These some beans are there. This soya bean is there. It is natural source of all the beans. They have small quantity of estrogens, so you can use beans soup from the beans, French beans, soya beans, all other beans, they are good sources of natural estrogen. We don't have to increase the estrogen too much of it. We just have to uh, give. Even if you are doing yoga, your estrogen will increase. So if we are increasing too much of estrogen, then that can also, we have to land. We don't have to keep flying. Okay. So this shatavari or the shatavari is a very good source of natural estrogen. These yams, wild yam, or uh, the things which are growing under the ground, they are good sources also of the estrogen, natural estrogens. So sugar beetroot also. So such things which are growing under the ground, they are good sources of natural estrogens.
Thank you. And maybe the last question for today. What about the fish in the diet? Should we increase the quantity of the natural source, like meat and fish and eggs? What is your position on that?
Well, fish, I'm not against eating fish. I'm not, but these other meats like chicken and red meat, all the other meats, they are not naturally grown or naturally raised. So that's why they can be hormones, there can be injections on those meats. So just avoid them. But if they are naturally occurring and if we are eating them since your childhood, that is also very important because your body got used to it, that you can eat it. So it's not, it's okay. I'm talking from a physical point of view or the material point of view, not from the spiritual point of view. So if we are looking for spirituality, then it is a different story. Then it's a big no to eat other animals. But if you're looking for some physical gains or something physical, which for taste or for some strength or some muscular gains, so you can have it in small quantity, not every day, sometimes. So fish is still okay, the seafood is still okay. People are living in Japan, in Southeast Asia for long lives. So they are eating a lot of seafood. So seafood is fine. And other heavy foods, red meat, not recommended. Heavy for your body too much. So for the minds, if you ask me from sattvic, rajasic, and tamasic aspects, all non-vegetarian food leads to tamasic thoughts. So for the mind, it is not good, but for the temporary medical point of view, you can eat it. It's not a
Thank you
problem.
for your answers today. We need to finish to stay in the time limits what we promised. So I'm encouraged to send your questions still in the chat or in the WhatsApp and Telegram groups. We will open the vote for the next seminar after a week or two. Please actively be involved in this. Please send maybe your suggestion of on the topics what we should cover. And I'm grateful for Dr. Vikram for his time, for sharing this knowledge with us. I'm also appreciate the effort and time from our translator, Alina Voronova, who helped us with the synchronized translation to Russian. And myself, Alexander Laktionov, Planet Ayurveda Baltic. We wish you a good day and see you next month.
Thank you very much. The crux of my lecture what I wanted to say was that the key to health is balance. So maintain the balance in your thoughts, in your food, in your lifestyle. So everything will be fine. Thank you very much.